what do you think about DNA repair? Or do you feel, is the science there in your eyes, or do you not, you're not ready to kind of recommend those products, Terrence?
DNA repair products, you know,
Yeah, DNA repair enzymes and products. Yeah.
yeah, I mean, and there's there's the DNA repair, there's regenerative products, you can use the growth
Yeah.
factor serums, you have topical exosomes. I mean, there's a whole kind of rabbit hole. And
Yeah.
so, you know, I try to, retinoids are my start. And then
Yeah.
depending on the sophistication and the proactive nature of the male patient or any of my male patients, I sometimes graduate or they can't tolerate the retinoid. Or then you can get really sophisticated and you start alternating. I tend not to, I won't use those products at the same time. So if I'm incorporating a DNA repair or a regenerative or collagen stimulating product, then I have to back off of the retinoid, or you can alternate. But this
Uh,
is this is kind of more. This is where you're. This is kind of like the graduate school course of nighttime
yeah.
skincare, and it could get complicated. Where my female patients are like, "Give it to me, like this make it as
Right.
complicated as possible." I do have male patients that do that, but I don't start them on that pathway.
Okay, so for you, okay, so hearing you loud and clear, then foundational antioxidant in the morning, moisturizer, retinol at night. That's the first step, and many patients will stay on that step and still do really well. But if they're willing to go a little bit kind of beyond that, we have lots of different options. Corey, do you agree with that approach?
Yeah, I think that nighttime belongs to the retinol. That's your skin's
Okay.
chance to rejuvenate itself, to kind of rest and, re-up for the next day. And the nighttime is a perfect time to do that. I pair it with the dental floss because you should be flossing your teeth every night, not just brushing them. And that encourages behaviors that, will hopefully help each other to be stronger. DNA repair enzymes. That's a good question. This is where I really start to get into products that do more than one thing. So, maybe I can find a sunscreen that has DNA repair products and get them to commit to that alone. Then we're talking about, like Terrence said, I want you to show me that you can be consistent with three things before we start adding, four, five, and six. If there's a particular um, what am I trying to say? Need in your skin. If you have dark spots or if you have redness, people are going to be more motivated to treat something that they bring to your attention that they see as a problem. But as far as us adding things, and then some of these regenerative products, the science I don't think is there 100% to really buy in, to recommending that all the time. I'm a huge proponent of foundational consistency with products that have a proven track record, like retinols and hyaluronic acid.